For the band terminal knee extension, or TKE, you're going to take a band and secure it around a sturdy post or other object that is not going to move. Get it around knee height and then get the target leg into the band loop. From here, you're going to gather a bit of tension. You're going to sit the hips slightly back like this and then brace your upper body against the post. From here, you're going to straighten the knee, pulling backwards on the bands, hold it for the prescribed amount of time, and then you're going to slowly release. A vast majority of the work should be felt by the quadriceps, the muscle on the front side of the thigh. If you start to feel it elsewhere or you just don't feel the quad kicking on, really just focus on trying to flex the quad, pulling the knee backwards against the band, and touching that heel down into the floor. Once you're there, try and just drive that heel down into the floor, and that should help to wake up that quad. A couple of pointers: I always have people brace their hands like this so that it's easier to keep the hip from moving around and isolate the movement to the knee. And then a common compensation, especially if the quadricep is having a hard time activating, is this back and forth movement of the hip. So sometimes what'll happen is once we try and get things here, we'll dip the hips back like this and then come back like this, and then the movement starts to look like more of this back and forth movement here. Try and keep the hip nice and still. Really just isolate that knee, pull the knee back against that band, squeeze the quad, slowly release.